മൊഴിയായി തിരകളിലേറി മലയാളത്തിൻ മൊഴിയൊഴുകും വഴിയും ഒഴുകാമൊഴിയായി തിരകളിലേറി മലയാളത്തിൻ മൊഴിയൊഴുകും വഴി പടരാം പവിഴക്കരയും താണ്ടി നാദരാഗമായി Radio Rang, color your life.
Good evening to all the Radio Rang viewers. Radio Rang is an audio-visual media with a different vision. Nowadays, everything online. There are advantages as well as disadvantages. During this pandemic, Radio Rang took an initiative to start an educational program away from campus to discuss about the various aspects of the digital learning for the benefit of students, teachers and parents. Since this is an interactive session, you can post your questions on FB Live. According to World Health Organization, health is a state of complete physical, mental and social well-being and not merely the absence of disease or infirmity. We are fortunate to have an eminent doctor who believes that humanity is the best quality one can possess. I have seen him with smiling face and extending hands to the needy people in the society. Dr. Babu Ramachandran. When we consult a doctor, we have to get 100% satisfaction. Dr. Babu Ramachandran is a doctor like that. GP physician, American Mission Hospital, Kingdom of Bahrain, Head of Anti-Smoking Clinic, Licensed Physician, Community Outreach. Good evening, Doctor.
Good evening. Good evening,
How are
Amritha.
you?
I'm fine. Good evening, everyone. It's really a pleasure to be here today with all of you. First of all, congratulations to Radio Rang and Rajiv in particular for taking this initiative and reaching out to the community. And Amritha for being the ever-smiling moderator in many of these episodes which I have seen. And I am honored and privileged to be a part of this initiative. Thank you, Amritha.
Thank you, Doctor. Thank you. Doctor, we won't realize when something happens somewhere unless we experience ourselves or our loved ones. The same way, first case of corona reported in Bahrain. Our Bahrain government handled it very nicely. Immediately they closed all educational institutions, started online teaching and partial lockdown declared and online purchases. In all the way, they tried to help us in this situation. During this pandemic, with your experience, how do you foresee the situation?
Thank you, Amritha. Well, if you ask me, like the end of 2019 or maybe even the beginning of 2020, nobody expected that we would go into the stage of a lockdown or we would stay at home. The human race felt that it had achieved everything. We went to Mars, we landed on the moon, we could conduct surgeries remotely. We thought we were supreme. Till a tiny virus, unseen to all, has entrapped us in our own houses. And that was the start of COVID-19. When it started in China, we thought, oh, China is far off. It won't affect Bahrain, it won't affect India. However, things got worse. It became a pandemic. A pandemic unheard of over the past 100 years, ever since the Spanish flu, I must say. In Bahrain, in this kingdom, of course, as Amritha said, we went through the lockdown or a partial lockdown. We handled the cases. I mean, the ministry, the rulers and the government of Bahrain took a very strong, positive approach. And we are fortunate to be here because all the precautions we took and all the safety measures followed by the citizens of the Kingdom of Bahrain helped in slowing down the incidence of COVID-19 cases. Of course, there are many cases. I'm not saying that we are the best of the best, but compared to many other parts of the world, we, I must say, are in the forefront of trying to control this pandemic. We have now reached a stage where there is no looking back. People ask me, so when will this end? Every person with whom I interact in the clinic and outside has this question. Doctor, do you think it will end in 1 month, in 2 months? Is vaccine the ultimate solution? Are there medicines? Many questions which are answered and unanswered. Initially, we thought it will go in 3 months. Then we thought it will take 6 months. Now, what happened from February onwards is still continuing, maybe to a lesser extent. And the medical fraternity has got some control over the disease, knowing that we will be able to rein in the disease. It's not something which is going to persist for years and years together. However, it's difficult to say when we will see light at the end of the tunnel. But definitely there's going to be light at the end of the tunnel. And we are going into a phase where we call it the new normal. The new normal, where there may be distance learning, e-learning, telehealth, you name it, you have it. But mankind has adapted to this situation, and adopted means to tide over this crisis. Impossible to say that in the 3 months or 4 months. However, we will live through it. We will definitely live with COVID-19. I would not say that we will have a post-COVID era in the near future. It will be living with COVID-19, but that's not to worry about, dear viewers.
True.
Yes.
More than 7 months we face the same situation. Now I think it is the part of our life.
Yes, exactly.
We adapted and we adjusted accordingly.
True.
And we are facing all these consequences.
Right.
Okay. Doctor, wearing mask is
Yes.
very good to protect ourselves from all the diseases,
Correct.
like infections and all.
Correct.
So, is it good? I heard that, okay, we are taking carbon dioxide more, and I was going for walking.
Right.
Okay, so then one of my friends called me and told that don't wear mask because it leads to cardiac arrest. So, just what about wearing mask? Is it because we have to wear anyway, but
Right.
all of us are concerned about it,
Correct.
about the gloves also, wearing gloves also.
Well, masks have become a part of our daily attire. Just like we dress ourselves, wear our shoes, now we have to wear a mask also. And innovations of masks have come in, branded masks are there. But the question which Amritha asked, that when we go out, do we need to wear a mask, at least when we do an exercise? You see, when you look at the mask that we are supposed to wear, when it covers us, like let's say we take a mask and we are supposed to wear it covering the nose and the mouth. This is the way of doing it. And when removing it, we have to be very careful in removing and see that we don't touch anywhere. That's how a mask is worn. The question of heart attacks and so on, which Amritha referred to, is not true. In any way, it's not scientifically proved that when you wear a mask and do an exercise, you have a cardiac arrest. You see, there are lots and lots of messages floating around in WhatsApp, in Google, in Yahoo, social media. People come and bring reports of what they have seen in WhatsApp groups and ask, is this correct? Many of them are just false information. And it keeps on getting forwarded, till confusion is there among the common public, among everyone. When you wear a mask, there is nothing like it conceals your nose and mouth, but does not suffocate you as such. Because it's not a totally watertight one that we wear. However, when we go for some exercise, what happens is, due to the exertion, we breathe in more, we breathe out more, the heart rate increases, and at those times, when we have brisk exercise, there is no need to wear a mask. Let it be free and open. Does that answer my question?
Yes, very much. When we use staircase also, just we get ourselves suffocated. So all of us are worried about it.
Yes.
Okay. So how to wear the mask? I attended many webinars when you conducted. So the way of wearing mask. So whenever I remove mask, I used to remember, okay, how the way you delivered over there, how to remove the mask, how to wear the mask. So it is very much useful. We attend many webinars, but we have to recharge ourselves. We forget easily. So that is the purpose of the show like this. Doctor, we got many questions through the Radio Rang app. Okay, since this is the digital learning, okay, we are discussing about the health during digital learning. So we have one brother and sister online, Avani Sajit Kumar and Akshat Sajit Kumar.
Hi, Avani. Hi, Sajit.
My name is Avani.
Akshat Sajit
My
Kumar.
name is Akshay. We both are studying in Annur International School and I am studying in 8th grade. I am studying in 5th grade. We both are having online classes and online classes started in the month of March for both of us. So after a few weeks itself, we both started to have irritation in our eyes and we both started to have itching and a lot of irritation, and also our eyes became red, so that because of those issues my father bought refreshing eye drops, so we were using that. Then our vacation came, and after the vacation in September again we both had online classes and the same issues like the irritation and itching occurred for us. So our father suggested an idea. We both bought anti-glare glasses and we are using it now. Not only that, sitting for the laptop for a long time also, we both are having headache and all, and after the classes writing the notes and all, full time in the laptop, both issues for the eyes and headache is there.
Okay.
Thank
Thank you
you.
dears for that question. Well, all what you said are effects of e-learning or effects of the electronic media that we are using today. Unfortunately, we have to go through the virtual classes. It's not the classroom where we interact with the teachers. So when you keep on looking into the computer or your mobile phone as part of your classes, eye strain will happen. And that's why you get itchy eyes, burning eyes. Because looking at the monitor continuously for, let's say, even more than 30 to 40 minutes is not supposed to be good. So now what is the solution? Because we have to adapt ourselves. You don't need to go in for this refreshing eye drops and so on, the brands which are available in the market. What you need to do is, they say that if you can blink just for a few times in between your face-to-face viewing on the computer screen, that can help. The second one is, after looking into the computer for some time or staring at the iPhone screen, slowly look to the distance and relax. That will help you. And after 30 to 45 minutes, stretch yourself, go on, wash your face, and just look out through the window. That sort of a relaxation will certainly bring down your headache and your irritation of the eyes. But let me tell you something. In between classes, when you have a break, don't again go on to your games. I think that's a concern which many people have raised. That is to relax from the tough schedule of watching a teacher online And when you have a 10-minute break, instead of taking a break as such, you take a break by going on to the games and PlayStation and the adequate number of avenues that you have to play games. But that's not it. Leave it aside, and during the break time, just relax. Don't even look at the computer or the mobile phone.
That's true. Doctor, usually we blink our eyes around 20 times, no, normally.
Yes.
But when we look at the screen, I think it is not happening 20 times. More time we are looking at the screen only.
Right.
And the screen the distance is very less. That is the reason you advised to look at, at certain distance.
Correct.
Okay. There is a possibility of getting short sight due to this?
There is a possibility of having some vision problems when you are constantly on the computer.
Okay.
But see, as I told you, we are going into the new normal situation where you have to have this e-learning thing.
Yes.
So it doesn't mean that because you are always on the computer, you will get short sight. No, I wouldn't say that. However, if you have a problem in your vision after, let's say, being on online classes for a month or 2 months, get your vision checked to see if there is any defect, and go ahead with the advice of the specialist who sees you. That would be my advice.
Yes. That's really nice. Instead of going the eye drops which we don't know.
Yes.
Okay, it is better to do all this exercise. When I spoke this subject to doctor, then I told after the session we have to follow this. That is the purpose of the session. Because we know all these things but we never do. After each and every class, I used to tell students that, children, please stay away from all gadgets.
Exactly.
Close your eyes and relax.
Very important.
Then just stretch yourself. All these I'll tell. My students used to tell that, teacher, you too. You answers all the questions which we send as soon as the class finished. Through WhatsApp we interact. So that's very nice. Even children are concerned about our health also.
Teacher has said everything. Whatever I have said, she has said it, and that's it.
So we used to tell, but still, okay, they don't treat us as a doctor. So when you tell, all of us are concerned. I told you, the way you wear the mask and remove the mask, when you showed at that time, I always remember and follow that. So as a human being, we forget easily, so we have to recharge. So all of you, please follow all these instructions, and strictly you have to away from the gadgets during the break. During the break, you have to utilize the time wisely. That is the main concern. Doctor, we have questions online.
Sure.
Does fear affect our immunity system? Actually, students are panicked about the offline classes.
You see, one of the greatest things we have noticed, when I say we, I mean the medical professionals have noticed, is that there's a lot of stress going on. Stress for everyone. And there's a fear. What happens if I get an attack of COVID-19? What happens if I get infected? Will I spread it to my near and dear? And watching the media where they highlight a lot of deaths, we have a tendency to think of the worst. You see, this fear and stress are human nature. But we should learn to overcome this. I always say, fear is the dark room in which negatives are developed. Fear is the dark room in which negatives are developed. So, from that dark room, we should go out and become positive. And we should learn to control our stress. Don't allow stress to rule your life. You should outwit stress and bring stress under your control. That's an advice I would like to give you during this era of the pandemic.
Fear won't give a solution.
Fear will not give a solution. I will not say that because of fear you will get a disease. I don't say that. But there are studies which show that being stressed can lead to a lot of medical problems, including heart-related problems, being too overstressed. But when I say stress, there are two types of stress we say. One is eustress, EU stress, which is the positive stress, like relishing a problem and trying to solve it, doing something when you are faced with an issue which will help you out. You see, these are positive things, which is known as eustress. There is another factor known as distress, which is negative stress, that when you are stressed out, you don't attack the problem, you still cringe within yourself, you are afraid to face stress, and that can pull you down. Eustress is positive, distress is negative.
Correct. That acute stress and chronic stress
Yes.
is there, no? So during the acute stress means it's for short.
Acute stress,
short
yes,
time.
yes.
During exam time, or
Yes.
if we have to do something.
Right.
Okay, something like that. But chronic stress is not at all.
Not at all good.
Sorry.
You see, you can have, when there is, let's say, as a teacher said, there's an exam. Everyone will be under stress. And that's that acute phase of the stress. You are stressed out. Maybe it's because you have not studied well. Maybe it's because you are still worried about whether you will get the questions you studied. Every person, right from the little child to adults, they all have stress. But there are phases of acute stress. If the stress keeps on accumulating and you ruminate every time on stress, and it becomes a chronic problem where you cannot manage it, the stress, if it affects your sleep, if it affects your daily life, that's something which has to be medically addressed. Acute stress, okay, leave it. The exam goes, the stress point goes, you are free. That's how it is. Is that clear about that, the chronic stress?
Correct. It's clear. Doctor, when we mentioned about stress, I got two questions. They don't want to reveal their names.
No issues.
Okay. During the online teaching, definitely we all face technical issues.
Correct.
It will get stuck in between, and definitely we will be panic because what will happen
Right.
there, and so even the teachers know that it happens. It is not going to affect them. Still, BP shoot up.
Right.
Another parent has sent that she has 3 children. All of them are attending online classes.
Correct.
And she has noticed that they are chatting with their friends in between.
Right.
And they don't take it seriously. They don't take any responsibility at home. So seeing this, she is frustrated.
Right.
And now at present her health condition is very bad.
Right.
Her BP shoot up, and there's a cholesterol level also very high. Unfortunately, she was hospitalized for a few days. And how to overcome
Yes.
these stress?
Thank you, Amritha. Well, to those people out there, what I would like to say is, of course, sorry, of course, as you rightly said, the teachers are not in a very good situation when it comes to online teaching. The students have their own issues. The parents have their own issues. Because earlier, for the parents, it was easy in some ways to just send the children to school and the rest is left to the teachers. So the limited time that they have with the children during the daytime is before they go to school and after they come back from school. Now times have changed. The parents are there with the children. So in a way, it is the parents getting a dose of the medicine which the teachers usually get in school. Because I have a great respect and I have always paid tribute to the teachers for the hard work they do, and I mean it. Because the effort that the teachers take, whether it is online learning or offline learning, classroom learning, it's tremendous. And it's not easy for a teacher to just look at a screen and keep on teaching, not knowing on the other side whether the students are listening, whether they're really onto the computer, or whether they're just playing with some other gadgets. And this is what frustrates the parents about what you said about the parent getting the getting blood pressure problems, being hospitalized. Yes, because it's all the stress that accumulates within the parents, the frustration that develops when they see that the children are not really following instructions. And to cope with 3 children at the same time when they all have classes is not a joke. However, dear parents, what I would suggest to you is take it cool, relax. This is all a passing phase. The children today know much more and they know how to adapt much better than we adults do. Give them their freedom and don't take all the stress of the classroom lessons and the homework and the online learning upon yourself. Slowly, you can get over it. Just understand that your health is important. And the health of the parents is very crucial to the family atmosphere. So remember, don't get stressed out and get your BP, blood pressure to higher levels and go into panic situations. Don't lose your sleep based on that. There's a time for relaxation, there's a time for work, there's a time for leisure. Take it that way. And admire the teachers who are doing online teaching for your children.
Taking stress is not at all useful in our life.
Definitely not.
So better not to take stress. It is easy to tell you, but we have to make it practical.
True.
That is very essential. During the online classes, anyway, just what I came to know is most of the parents, students and teachers are satisfied. We get response, and very rare we don't get response. That case is also there. But some technical issues will be there, or it's a triangular connection. No, always I used to always mention about triangular connection: teacher, student and parents. With all the 3 support, we can overcome all these issues. Doctor, there is one more question is there. To live, we have to work, and to work, we have to live. This quote shows the mental tension the world is facing today. At workplace, we interact with many people and share pen, documents, computer system, etc., which might not be sanitized. How much is it going to affect us? Reshmi Sibu posted this question.
I'm sure this is this is with reference to the present COVID-19 situation, where there were some suggestions or some postulates that the virus can remain on the computer keyboard for a few hours. It can remain on the pen, the paper. Well, it's not an unfounded doubt that you asked. When you go to work, the advice I would give is, you don't need to spray the whole room with a sanitizer or even the keyboard and the computer screen and so on. Just with a very light cloth, maybe slightly moist if needed, just wipe the keyboard clean, wipe the pen that you are using, and wash your hands well. Don't go in for an overdose of sanitizer. I know a case where when I met someone, he told me that his mobile phone was spoiled. I asked how. He said, every time I was cleaning the screen with sanitizer and it got spoiled. Don't do that. See, have a little caution. Use your mask. If you're using your gloves when you go somewhere, you see, the one purpose of the gloves is when you're wearing a gloves, you won't touch your face that often. And moreover, you'll be conscious about how you move about and where you place your hands. That is the way the gloves help. So you can use your gloves, but again, discarding the gloves, removing it slowly from both sides, and then discarding it in a proper waste bin, just like the mask. That is important. And use sanitizer. When you go to a supermarket or any other place, use a little sanitizer. And when you come back home, you can just wash well with soap and water instead of just using the sanitizers. So that option is yours. Don't overdo it.
Yes. There is a tendency of asking sanitizer. Okay, just now only I wiped with sanitizer. When someone takes, okay, give me.
Yes, yes,
That
yes.
habit is there.
That habit is there.
And some are allergic to sanitizers.
Yes, yes.
So in such cases, what is the alternative?
Soap and water.
Soap and water.
That's the only way out.
Okay.
Because a person can be allergic to, they say, anything under the sun, including the sun. So that means that you can have the allergy to sanitizer, the chemical there. So if you are allergic to sanitizer, there is no solution to that other than avoiding sanitizers and washing your hands with soap and water.
Okay.
The washing, they say, for 20 seconds, cleaning it well.
Okay. So to avoid that, actually, we are sending WhatsApp messages to inform our attendance. So all the schools, all the officers are taking care, I think.
True, true.
Because we are avoiding maximum pen, paper, etc.
True. You're going into that, what do you call, electronic world, or the virtual media, and everything is online and so on.
Doctor, one more question. Mrs. Usha Binni posted, I'm a teacher and I take online classes. Recently, I have started getting neck pain and pain on my right hand, which was not there during my classroom teaching.
True.
So,
This is again what I would call as an occupational hazard, or let's say because of the nature of your work. Because you're in a classroom, you're used to getting up, moving around, seeing the students before you, moving your arms, and the body movement is adequate, the eye contact is good, you see others, you look at people. But when you are stuck in front of a computer for, let's say, I think it's 45 minutes at a stretch,
45 to 50.
45 to 50 minutes at a stretch, it's hard not to get this body pain or shoulder pain and neck pain. However, after 20 to 30 minutes, if you feel you need a break, just tell online itself, just permit me to relax, let me just relax. And you can relax, stretch yourself, move your neck to the side, up and down, a few body movements like that. And after the 45-minute class, again you take a break. We say about ergonomics, that is the way you position your computer, the way the screen should be fixed so that your eye has got perfect contact with the camera, and also the chair that you sit on with a perfect erect back, feet firmly placed, arms comfortably placed. This will reduce the incidence of such injuries or illnesses related to the neck and shoulder.
This is the majority of the issues: back pain, neck pain.
Yes.
Just right hand pain.
Correct.
And eye problem.
True.
These are the main problems we face during the digital learning for teachers, for students, those who are in the offices, also those who are using. I
Yes.
think these are the common problems we have to.
No, IT professionals have the same issues.
Yes.
Because they are at the computer for so many hours. We never thought of it earlier, but I know many IT professionals who come with these symptoms, pain in the neck and so on. That's because they are glued to the computer from morning 8 o'clock till evening 6 o'clock. And they're so engrossed in their work that they don't even take their eyes off the computer. But then there will be a burnout if you do it like that. That's why we tell you to relax. And that same applies to teachers, because now teachers are more focused on online teaching. So relax. Because the moment you are stressed out, even stress can cause pain in your shoulders. So relieve that mental stress. Look at it as something which you have to live with and get adapted to that one.
We have to get up after each and every class. That is
True.
the one and only solution we have to. We have to decide ourselves how to overcome it.
Exactly,
And
exactly.
we have to do. That is the main thing. Because I am also a teacher now, so I know that I have to get up. But in between, what I do is the next class, all the setup will do. This is going on, but still, after watching this show, all of us have to follow these instructions.
No, Amritha, what you said is true. I think your classes start at 8 o'clock, right?
Yes,
Or
8 o'clock.
8 o'clock.
8 o'clock.
And at what time?
Till
does-
1:15.
1:15. That means 8 to 1:15. 5 hours, 15 minutes.
15 minutes break is there.
No,
in
the
between.
break is there, but I would advise teachers to utilize that break as a real break. Not during the break, again you go on trying to prepare for your classes, trying to, I know you always try to give out your best, you teachers, but that 15-minute break should be a real break. Just like I said for the students, when they get off and they have that break of 15 minutes where they don't use the gadgets, my advice is the same to the teachers: get off your gadgets. And also to the parents, okay, if you're really focusing your attention on the child while they are in class, during that break time, you too should relax. Don't ask them about the previous class. Don't ask them about the next class. Let them have their time. Parents should have their time. And teachers, as you said, the triangle thing.
Yes.
All points of the triangle should be equally relaxed.
Equally relaxed. Correct. Health is wealth.
Health is definitely wealth.
All of us have to take care of our health. Dr. Lekha Kakkadi posted one more question. Is that stress create any chemicals supporting virus?
You see, that has not again been proved. You say stress releases some hormones and chemicals and so on, but that does not mean that because of the stress, the chemicals that are generated or the hormones or whatever adrenaline surge is there when you are stressed out or so, will not really cause a disease. It will not lead to incidence of COVID-19. I know I've heard when I was a child, my parents used to tell me that if you see a chickenpox patient and you are scared, you will get chickenpox. I'm sure you have heard of that.
Yes.
They used to say, that's not really true. It's because you are exposed to the chickenpox virus that you are getting the chickenpox. It's not because you are stressed out and afraid. Of course, there is a thing that when you are stressed out, some studies have shown that your immunity may drop a little. Whether that can lead to an illness, it's too hard to say.
When we use negative things, okay,
Yes.
don't see this, then we have a tendency of watching this.
Always remain positive other than COVID. That's the only thing.
Doctor, we have one parent online, Advocate Meera Menon.
Hello, Doctor and Amritha ma'am. I am Meera Menon, a mother of two boys aged 15 and 11. This is with regard to my younger son who is 11 years old. I have observed that whenever he is sitting for an online class or any online session, or even when he is watching a movie, after some time he just sleeps off. He seems to be disinterested and he sleeps off. How much ever interactive the class is going on, activities are going on, children will be responding positively and promptly, but he looks so disinterested after some time and sleeps off. So my concern is, like, how can we overcome this situation? Because basically he's a child who is full of energy and who is very active. But when it comes to any screen, when he has to sit in front of any screen, he is kind of he sleeps off after some time. He cannot stay alert after a while. So how can we overcome this situation? Thank you, doctor.
For some time may sleep off, who listen to lectures. Like, if I may say on a lighter note, even we doctors, when we attend a continuing medical education program, we may tend to sleep off after some time, even though the lecture is the very best. But that's because you are seated in a comfortable place and you listen in a calm atmosphere, and the mind might wander after some time. The other thing to be noted is your child getting the adequate rest when he is not in the class? See that he gets adequate sleep, see that he takes his food properly, and slowly you can train him not to sleep off during the classes. Even when watching movies, if you feel that your child is sleeping off, wake him up. It's a practice. It's a practice that we have to build in. Especially students, they may have to listen to lectures for 45 minutes, and if you sleep off after 15 minutes, well, they lose the remaining time. No, train them, gradually train them. Don't force it upon your child, but train them in such a way that they remain awake. That's one thing you have to remember. And added to that, see that he gets adequate sleep. 6 to 8 hours sleep. 8 hours sleep, I would say, is good. Hope that answers my question.
Yes. It happens during digital learning. I experienced many times when we call, okay, one student to respond, there won't be any response. Okay, mic will be working, everything will be perfect. Then in between, when we get time, we used to call the parents and remind, because they are not knowing.
Yes,
when
yes.
they sleep. Even when I attend webinars and when I attend online classes and all that, okay, it will be very interesting.
True.
But still, we have the habit of sleeping, no, while watching TV, while watching movies.
It's because you are not adequately rested.
Yes.
That's why.
That's the reason.
Yes.
So in between, we have to train ourselves to get up in between, walk. We can realize, no, when we feel sleep. So just teach them how to relax, how to overcome all this. This will be the best way to overcome this problem.
Exactly.
Okay. Doctor, one more question. Our Anand sir posted, panic and stress are correlated. How can we unwind it?
Hi Anand, good evening. Good question. How can you correlate panic and stress? So, well, you see, there is no watertight compartment between panic and stress. In the sense that when you are stressed out, you panic. And when you panic, the stress increases. I know people who come in with panic attacks. They are worried. And the stress, suppose there is a demise of someone close to them, that stress is there, and that stress might lead to panic attack. The only way to control this is to relax. You have to learn to do some, let's say, breathing exercise is good. It will fill up your lungs. Think, analyze the situation, because when you are stressed out, you don't think rationally. But speak to someone if you are stressed out. You have your partner, or you have your friend, or your parent. So when you are stressed out, open out to someone. Tell them what your stress is about. And once you tell them what your stress is about, it does not remain bottled in you. You have shared it with someone. And that will prevent the occurrence of a panic attack. If you panic about something, like you see a dog rushing to you, you panic. Of course, that's a panic reaction. But again, you tense yourself to see, how can I get out of this situation? So when you panic, first think rationally on whether you can get out of that panic situation. If you cannot, seek help. There is nothing wrong in seeking the help of your friend, your partner, your colleague, or if the stress becomes too much, get the help of a healthcare professional.
Nowadays, I'm just hearing this word panic attack.
Yes.
Okay, just as you said, when we are not in a good mood, we have to call our friends or family. Just in my case, I used to tell that whenever I get some problem, okay, I used to call my friends or relatives. Unfortunately, all of them will be busy. Immediately, they will tell Amritha, I'll call you back. So, just sometimes it happens. We have to.
I'll tell you a solution for that. You see, if you are stressed out and you're panicking and you don't get anyone, take out a book. Write down what is stressing you out. Just record it on paper. I'm not saying, again, take the laptop or something and punch it in. Take a notebook and the old-fashioned way, write down your stress. Just keep on writing for some time. Go out into the open, take some juice, water or whatever it is, and relax if you don't get anyone to speak to. That way you can bring down your stress level. Because in this era of the pandemic, there are lots and lots of cases of people undergoing panic attacks and periods of stress. Maybe it's because of the loss of job, maybe it's because of the education, because our lives have been thrown out of gear by this tiny virus. However, it's not in our control to say that tomorrow we will get out of it. So learn to adapt to the new normal.
Try to give your time. That is the best solution. That
Yes.
is the best gift we can give to our friends.
Definitely. If somebody calls you and says, I am stressed, listen to them. At least for 2 minutes, listen to them and then say, okay, I will call you back. But at least that 2 minutes might help a person. That's what's important.
Being a doctor, I always appreciate you. Whenever I call you, give time.
I try my best.
I will be panic at that time because I don't want to trouble you because you may be at hospital or when I take your time, I am very much bothered about it. But still I appreciate you.
No, you see, as
patiently you are answering to all the questions.
as part of the Indian Community Relief Fund, the ICRF, we have got what is known as LIFE, ICRF LIFE, which is listen, involve, foster and engage, which is again a program which we have started not now in the pandemic, maybe 2 to 3 years back as well, where we offer our services to those who need help. They can call us on our helpline numbers. We are ready to help out.
Yes.
And I do get a lot of these calls.
Correct. Whenever I hear a medical issue, okay, I used to call you only. I trust you a lot.
Thanks for the trust.
And when the COVID cases report in their offices, naturally the primary contact list, they will be worried about it.
Yes.
Do you remember on that day I called you, you gave a clear reply and I just told them I could help them. A lot of friends, just they got relief.
No, people do call because everyone is of course worried about this COVID pandemic. They don't know, do we go out? How long do we stay in? It's as though the virus is at the next door waiting to get in. And if you look at the previous setup, you know, when it started off, the pandemic started here, if one person in a building had it, the whole building was locked down. Now, it's become part of life.
We used to tell that in Gulf, it is not at all an issue. In our house also, if something is having COVID, so it's okay. But in Kerala, the situation is different. Now it is part of the life.
It's part of life. It's part of life.
Because initially it will be like that. Here
Yes.
also lockdown was there, the building will be closed. Now it is the part of our life. And just what I noticed is actually anxiety is the main reason.
True. And this anxiety causes people to take unnecessary medications.
Correct.
If you look at the medication point of view, there are so many therapies which are spread by WhatsApp. People tend to overdo it quite a lot. Relax. Ask a healthcare professional if you want some advice and follow that. That's my advice in this aspect.
In any case, do you experienced in any circumstances the second time it gets affected?
As such, I cannot recall anything, but you know, I am not in the forefront of the COVID team in Bahrain because our hospital is not a COVID hospital. But according to studies also, though we say of a second wave and so on, or a second time getting infected, the latest thing we say is that if you test positive once, that is you are tested positive, within 10 days, that infectivity is supposed to have gone away. That's why even the ministry has brought out a rule that after the first test, if you are positive, 10 days later, if you don't have symptoms, you don't even need a retest because this virus can remain in your system, they say even up to 90 days. But that doesn't mean that you are infective. They are the dead particles. So even if you do a test and it's positive, if you have not had any contact with anyone else over the past 10 days that you were in isolation following a COVID positive situation, well, after 10 days, even if you test and find it's positive, don't worry about provided you don't have symptoms. If you have symptoms are there, you have to get back to the ministry and healthcare provider and decide how it is to be done.
Doctor, just during teaching, 2 teachers shared that voice break in between and feel giddiness.
Right.
And one of them went to doctor for a consultation and diagnosed with high diabetics as well as this thyroid. So today only she called. So is it a possibility to get thyroid and diabetics during this situation?
You see, in a stress situation, a diabetic patient may find that his sugar level is increased. During a stress situation, people who don't have blood pressure might show a rise in blood pressure and experience giddiness. Because that stress is so much that stress can cause a rise in blood pressure. And we say stress can also cause heart problems. But as far as thyroid is concerned, I don't think so that there's any correlation between stress and thyroid, to my knowledge.
Okay. That voice break, is it due to thyroid or?
No, the voice break again I would say is because of overuse of voice.
Okay.
Because at least in a classroom you know that the children are there, and if what you say you cannot hear, they cannot hear, they will say, "Madam, I cannot hear." But here this means you are straining yourself so much that that can cause a break in voice.
Okay.
So learn to cut down on that. Use your voice to the extent possible. Don't unnecessarily stress your vocal cords and shout or tell your lessons or give classes in a very loud way, because that can cause a break in the voice.
Okay. And drinking water in between also, just a
Sips of water, yes.
Okay.
You can take sips of water while in a classroom, while continuously speaking. As you know, even I have been taking sips of water in between. It's good to take, because then the throat will not become dry.
Correct.
Don't have to feel
Because
embarrassed.
that's what
about
my
that.
experience. Because in between taking sip of water, it is very much helpful during the class.
True, very true.
It will be good. Doctor, one more parent is online. Mr. Anil Kumar, financial manager.
Yes. Hi Anil.
Good evening, everybody. COVID-19 coronavirus has badly affected each and every individual across the world. To safeguard our children and students, the best option is to stay at home. And that's why these online classes are going for the past 5 to 6 months. But I feel there is a concern. In school, they walk, they run, they jump, they play in the playground, they do PE activities. But here, for the past 6 to 7 months, they are confined to their houses.
True.
And there is total lack of physical activities. So I feel it's a big concern. My 2 children are attending the online classes, and I see the same thing. They're just sitting. There is no physical activity. So lack of physical activities is one of my concern for the students who are attending online classes.
True.
Thank you so much.
Thank you, Anil. What you said is the reality of the situation. That children are more into online learning and they don't get to interact as they go to the school. But there is a solution for this, in the sense that after the classes, you as a parent can just take your children out. Let them walk around, let them go to some open space and make them run around, have a few games like that. Some physical activity is good. This physical activity will keep them fit. The other thing is, which I have noticed over this past 8 months, is the incidence of obesity. Obesity in children and adults. Because with not going to the office and working from home, and the children being at home, and mothers making wonderful snacks for them, you tend to keep on eating.
Correct.
And that will cause obesity. So I'm not saying you should have a definite schedule to live your life, but avoid those unnecessary snacks in between. And just because you are not going to, that your children are not going to school, does not mean that it should be devoid of physical activity. Take them out, let them run around the house if there's space, or let them go down, take them to a ground. There are so many grounds here. Take them to the beach. Let them roam around there. Maintaining social distancing, they can have their own time. That way, you can overcome the lack of physical activity. Try that out. This is the advice we all give to our the children who approach us.
Correct. In the classroom, it is easy to ask a question.
Yeah.
When we feel that, okay, he is sleepy, immediately we'll ask a question.
True.
So he gets up and answers, then sit down. And then it happens in the classroom. But unfortunately, during online classes, it's not possible.
True.
When they stand and tell also, the mic won't be audible.
True.
So this way we have to practice. We have to give physical activities and lockdown specials. It was the main attraction during the holidays. Many children started YouTube channels. And as you said, overweight was a big concern.
True.
I told you, I go for walk. Because I could make out. Okay, if I go this way, after 2 months, I have to go for a purchase to buy dress.
True.
Because it won't be fit.
It won't fit.
So that's the main concern. So physical activities are very much concerned. And during these days, actually during holidays, many teachers, they reduced weight. That was the remarkable change.
That's true. You see, if you have the determination, you can lose weight. You don't have to blame COVID-19 for your lack of physical fitness, or you cannot put all the blame on obesity.
Correct.
Due to COVID-19. Don't do it that way.
We stopped ordering food.
Yes, you see, try to adjust. I'm not saying you should not have a burger or a KFC or whatever it be in between, but try to take this in moderation. Definitely have some physical exercise. Go around, even if it's to throw out the garbage bag. Because I was listening to a speech today where a child said, now I am very much interested in taking the garbage bag out, because that gives me a chance to go down the stairs, walk up to the garbage bin, put it down. Physical activity. And an advice I would like to give the parents is, this is not something, the COVID-19 is not something which is going to get over in the next month or so. So give your children the independence. Train them to accept online learning, and don't be after them all the time. Let them learn to live with online learning. Guide them, but don't be always onto them and admonishing them at every move and telling them that, okay, you have to sit throughout. No, don't do that. Give them their independence. Children learn quickly. They will do the best they can.
Correct. They can dance in between.
Yes.
That is very good exercise.
It's a good exercise.
And
They
Mr.
can.
Anil Kumar is going through very stressful work, and he himself find time to draw. That background, go
Good.
Corona, he did it.
You see, what you can do is, you can find out your hidden talents during this time. If you are not good at singing also, you can sing in the house, because the other people cannot run out because of the COVID-19. So explore your singing skills, even if you think that it's not that good, because nobody will run out. So do that. Buy an instrument, try learning it. And I've seen a doctor couple back in India. I think it was a YouTube which came, that they constructed or maybe arranged a studio on the top of their house and recreated old songs in a dramatic way. It was very interesting. You see, innovation is the key, and you don't need an innovation manager to tell you that. Everybody is an innovator.
Correct. Creativity is very good.
Yes.
That Avani Sajit Kumar and Akshas Sajit Kumar came, no?
Right.
Their mother Ramya Sajit Kumar. Just a 10 days challenge. I was wondering what all are the things she is posting. Glass painting in a very nice way she has done.
True.
So everyone, not only her, just everyone started their own passion, their own work they started doing. And it's very good to overcome the stress.
Yes. You can plan a writing challenge if you can. Writing 200 words a day.
Yes.
You start off writing. Day one, have 3 or 4 people in your group, because we tried it earlier. 3 or 4 people in your group. You write 100 words at least a day, starting from a particular date. Next day again you write 100 words or 200 words. And by the end of the month, you will be amazed to see what you have written.
True.
So it's a passion you can follow.
That's a very good idea.
Try that out. You see, you don't need to have a particular topic to write. Don't think you are not a good writer. Start writing. Think of your childhood. Pen down. I'm not saying put it on the computer or so. Take a book, the old-fashioned way. Write down. Keep on writing. Think of your childhood. Write down around 100 to 200. Don't go in for too much. Next day again. Either you continue from there or you take something else. End of the month, you should see the amount of words the number of words you have written.
Correct.
And it will be good to look through later. So go ahead. That's the best practice that you can do. You are at home.
Yes.
Do it. Children can do it. Adults can do it. Take up the writing challenge. Get 4 or 5 people together. Put them into a small group and each day they can post. Day 1, 200 words. The other person will put day 1, 150. Day 2, they don't write anything. Day 2, 0. Day 3, 100. Day 4, 100. Thus it goes on. So it becomes a sort of competition also. It's a good exercise and it freshens up your memory. Write about your mother. You don't need to write about things you don't know. Write about your childhood, your best friend. Bring it up.
Dear viewers, this is a very good idea. We can improve our communication skills. Communication skills, it's very important. In our life, if we don't know how to communicate, it is very difficult. So last episode, Anand sir pointed out about 5 a.m. club. So along with that, let us extend 10 more minutes to do this exercise.
Exactly.
It's very good. After all, just anyway, you have to write paper pen test. So they have to practice. So all of us, not only students, okay, all of us will practice that.
True.
Dr. Anand sir posted one more question. Is the pandemic the new normal?
Yes. The pandemic, I would not say that the pandemic is going to take us to the new normal. You see, maybe years back, we had at least healthcare institutions and all had planned to go in for telehealth and online consultation and so on. But now we have rapidly come to the new normal. It would have taken years to go into this, but now the pandemic has led to the situation where it is a new normal. And that word is being widely used everywhere, the new normal. And so I would say, adapt yourself to the new normal and go forth. Once the pandemic is over, my only humble suggestion is, people should not go back to their old ways where they keep on polluting the environment. You see, in New Delhi, they used to say that the climate was so polluted, nobody could even view anything. And in spite of this restriction on automobiles, they could not help it. But now, with COVID-19 coming in, it's clean.
Correct.
So it's a new normal.
Correct. COVID-19 teaches us many things.
Many things, many things.
Doctor, one more question. Mohammad Shamshad posted, when someone expressing stress due to COVID-19 thoughts, so what are common symptoms we should be aware? On what level of worsening symptoms we should seek mental health opinion?
Well, again, a very good question, because these sort of issues come up to me at times over the phone. That is, they are facing mental health situation like worrying about COVID-19, isn't it?
Yes,
is that what it is?
Yes.
You see, you get a cold and a cough. Now the thing is, you start worrying. Is it COVID-19? You feel that you're not getting adequate breath. Again you think, am I suffering from COVID-19? In a way, it's true. We are now in a situation where anything has to be considered as COVID-19 unless proved otherwise. Because there are different manifestations, there are asymptomatic cases also. But that should not stress you out, because it doesn't mean that everybody who gets a cold and cough is going into the fatal stage. If you have the cold, the cough, or you have a feverish feeling, get medical advice. If necessary, get a COVID-19 test if advised by your physician. And things to be worried about COVID-19 is, in case your symptoms start worsening, you get a high fever, persisting cough, breathlessness, severe fatigue. If you have any of these issues, go to a hospital. Talking of hospitals, people say, how can we go to a hospital? Is it safe?
Yes.
That's a big question which is asked. And I tell them, I go to the hospital every day. So, you see, if you are unwell, you should go to the hospital. You go to a supermarket to buy food materials. You go to other places, maybe to get some commodities or whatever it be. Like that, all hospitals here follow the regulations advised by the National Health Regulatory Authority, the NHRI, which is doing a fantastic job in the Ministry of Health. And hospitals are perfectly sanitized. And they see that patients with COVID-19 are isolated so that in case somebody comes there and who has got symptoms, they don't mingle with others. So these things are there. So bear that in mind all the time. Because you have an illness and the illness is getting out of hand, don't sit at home and make it worse. If you need medical attention, you will have to seek medical attention, be it through telehealth, calling a doctor, or going to the hospital. But don't neglect issues. But every simple thing, you don't need to rush to the hospital, you don't need to worry about, don't get stressed out about that. Because now we are going to go into the flu season as well, so it's going to be a combination of the normal flu and COVID-19.
Correct. During this situation, actually, I would like to thank all doctors, nurses, and all the medical staffs.
Thank you.
Where we all are concerned about going to work, okay, we will be getting COVID or something like that. Anyway, doctors, nurses, medical staffs, they don't have any other option. They have to go for work. Doctor, one more concern is from a parent. Their children are addicted to mobile phones.
Correct.
As well as the behavior change they noticed,
True.
especially anger.
Right.
Is there any possibility?
You see, before COVID-19, there was a phase when we used to tell children not to get addicted to mobile phones, not to view the screen for a long time. Now, with the era of e-learning coming in with the COVID-19 pandemic, we are forced to view the mobile or the computer for long hours. Correct?
Correct.
But you see, that can cause, let's say, behavioral disturbances in the child. So what you have to do is educate your child and make them aware of it. The problems with being addicted to the mobile phone. The younger generation, I see a lot many children who are addicted. And not only younger generation, even adults are addicted. Yes. You get up in the morning, the first thing you reach out is for your mobile. Check your WhatsApp. And only then you get up.
True.
Everyone does that. It's become, again, another new norm, I would say.
Correct.
So then how do you blame the children? When parents do it, children will tend to follow the parents. So put the mobile aside. You see, spare some time for them. Have some family time, and during that time, starting with the parent, put off the mobile.
It is easy to advise, doctor.
It's easy to advise. I know it's easy to advise, but it has to be done.
It has to be done.
If it is going to create behavioral problems, it has to be done. So these behavioral problems can be controlled. You don't need to be stressed out about behavioral problems and all. Make the child aware. They may get angry, they may get upset. Tell them in a nice way and bring them slowly into the right path. You cannot force a child to do something against his will. The only way is to tell them with love and train them.
Thank you, Mr. Anil Abraham, for pointing out this. Chitra asked one question, one of the parents. She has noticed about the dark circles around eyes, as well as very tired after the classes.
Yes.
But child did not complain. But as a parent, she has noticed, and since you are here, she asked me to
The
this
dark
question.
circles for the child?
Child.
For the child. Yes, that's because of excess viewing and the tired eyes. You see, the fatigue is always there. And for that, the solution is, after the class, wash the eyes well with normal water. Running water can be used to wash your eyes to soothe that. And dark circles as a sign that the sleep is not adequate, that fatigue is setting in. So see that your child gets adequate rest. As I said earlier, 6 to 8 hours of sleep is good.
Correct.
And rest in between the classes. That will help
proper
us.
sleep and proper break.
Proper sleep, proper break, and proper food habits.
Correct. Okay. Dr. Spandana asked one question. Difference between self-awareness and self-diagnosis. When we get sick, we are very good at surfing net. Okay, what are the symptoms? What could be the reason? And what will happen? We do. But sometimes it is helpful, but sometimes it is not.
Thank you, Amritha. That's a very, very, very relevant issue. On a lighter note, I would say that we doctors are employed because of Dr. Google and Dr. Yahoo. Because any symptom that you get, it's not something confined to the Indian population or let's say the Bahraini population. It's worldwide, in the sense that you have a headache, now with information at your fingertips, the superhighway of information. You click on a button and what headache you get, everything starting from brain tumor downwards. And you don't think of a simple headache, you think of the brain tumor first. That's human nature. So don't go in for self-diagnosis. If you have a doubt, consult your healthcare provider or physician. I have seen this phenomenon where I call it the I have taken it, you also take it phenomenon.
Correct.
Which, to elaborate, means that, okay, 3 people come together, one of them say, I have a headache. Now the other person dips out in his pocket, takes a tablet and give it to him. He eats it. He goes to some other place. They may say that, oh no, you take this one. And they give 2 tablets, they take 1. And I have seen patients walking into my clinic with a bag full of medicines for just a simple headache because of eye strain, and the medicines range from medicines for psychiatry to sleeping pills to high blood pressure medications and whatnot. So that self-medication and self-diagnosis is not good. Of course, if you have a doubt that your chest pain may be related to the heart, go in for a checkup. But if you Google and keep on trying to find out remedies over the net, I would not advise that. I'm not promoting doctors or hospitals, but I'm telling you that's not good.
But it's true. Actually, we should not do that.
Should not do that.
Because when someone tells about headache, then some will tell that, okay, last week it happened like this, and we
Yes.
think of the worst thing. And what I used
Good
to do
point.
this, just not now, but before the that COVID-19 cases, just I'll massage for 2 minutes, it will be all right. So they trust me and they'll overcome. Not all the time, I'm telling, but sometimes no, it is because of the stress.
Yes.
So in such cases, it will be okay. With Leban, you just wash your face. Some tips.
There are
like
some
this,
tips.
sometimes, yes. Sometimes it will be helpful, but still it continues. Then definitely we have to consult doctor.
No, the grandmother's remedies are there, which we say, which are always good.
Good.
And the practices which we used to follow and we continue to follow in the rural parts of India, they are very good. It will help prevent a lot of diseases like
Correct.
vitamin D, we say, is got by exposing yourself to sunlight.
Sunlight.
Huh? And here we are not exposed to sunlight, but if you look back home, even the Indian sari, it is supposed to give sunlight.
Sunlight.
So it reduces, it improves the vitamin D level. So those things are good, but that does not mean that for a chest pain or so, immediately you Google or you reflect back. Last week, this person had a mild headache and he collapsed and died. So do I also have a stroke right now? It's human tendency to think like that. However, if you have doubts, don't keep your doubts bottled up. Go forth and get a correct opinion.
Yes. So, doctor, we have to wind up the show. So, before winding up, what are the points you have to give once again to all the viewers?
You see, in a nutshell, if I may tell you about e-health or e-learning, I must say, you see, we are going into the new normal. We have to live with COVID. There were the pre-COVID days, and we don't know when the post-COVID days will be there, but it will definitely be there. But then, while we live with COVID, we have to adapt and adjust. E-learning, for the students, respect your teachers. You should understand that while you are online listening to their classes, the effort they are taking to train you. That is important. Listen to them. And you can maybe on the side play off with games and so on and cheat them. Don't do that. Give your full attention to the effort taken by them. And that 40 minutes in a class, utilize it well. Break time should be a real break time. Physical activity can be done either inside the house or by walks with the family. And parents, spend some family time together. Don't pull off the mobiles, but create an awareness that underuse of mobiles, especially since you're using a lot of mobiles and the computer while in class, the remaining time should be spent off your mobiles. Fix some time for them where they can interact, but make that a strict practice. Medically speaking, if you have doubts about your health, call someone and get the proper advice. If you are stressed out or tensed up, share your stress and your tension. We are going through a pretty bad phase which we never imagined in 2019. But we are slowly adapting, which is the word I always use, to this pandemic. So in that phase, you should understand that we have to live with COVID. And as we live with COVID, there may be stress factors, there may be tension, obesity is there, there may be health issues, but start living. Take life as it comes, because the time from the cradle to the coffin is short. Enjoy every moment of life in this world. Breathe fresh air. Take adequate food. Drink adequate water. And stay safe. And though we say stay at home, you have to stay at home for some time. However, with restriction, start moving around. We are sure that we will see light at the end of the tunnel. So remain hopeful of that. Thank you. It has been a wonderful interaction, Amritha. Thank you, Rajiv and Radio Rank, for giving me this opportunity to have such an interaction.
We are very much thankful, Doctor.
And with a teacher, and that's what I would say. As I said, yes. Even today, when my wife and I go back to India, we try to trace out our nursery school teachers to try to meet them.
Very nice.
That we do it. Medical college, we try to meet them just to say hello to them, to thank them. And that's the respect we have for the teachers. Yes. So thank you so much.
Thank you so much. Thank you, Doctor, on behalf of all the Radio Rank viewers and Radio Rank officials. Thank you for your precious time. And as I just mentioned, you met the target. Actually, just I told after this show, all of us should feel that we have to follow all these instructions. So dear students, teachers, parents, and all of you, please follow all these instructions. We are hearing this and we are very good at forgetting things. So please follow. It is for our health. Health is wealth. Stay safe. To overcome stress, as he rightly said, write many words or just many write-ups. It will be very helpful. So just many WhatsApp groups are there. So you can form a group especially for this. So you can improve your communication skills, and all the healthy tips what he has given, please follow that. And to overcome stress, to listen to music is a very good solution. So tomorrow at 7 o'clock there is a show, Symphony. Mr. Amblikutan, the famous musician, and Rajiv Vellikot are leading the show. I would like to thank Rajiv, Shubha Rajiv, Krishna, Srihari and Nikhil. Thank you and have a nice day. Good night. Thank you, Doctor.
Thank you.
ഒഴുകാമൊലിയായി തിരകളിലേറി മലയാളത്തിൻ മൊഴിയൊഴുകും വഴിയും ഒഴുകാമൊലിയായി
Let us see the real view. Let us see the real world. Let us see the real life. You wear it, you watch it, you feel it. Be real and be clear. Clear Vision Optics, Bahrain.
ഒഴുകാമൊലിയായി തിരകളിലേറി മലയാളത്തിൻ മൊഴിയൊഴുകും.
ഫ്രഷ് ഫിഷ്, ചിക്കൻ, മീറ്റ്, മട്ടൺ തുടങ്ങിയവ നിങ്ങൾക്ക് ലഭ്യമാക്കുന്നു ബഹ്റൈനിലെവിടെയും BQ ഫ്രഷ് ആപ്പിലൂടെ. കൂടാതെ ഫോണിലൂടെയും ഓർഡർ ചെയ്യാം. മത്സ്യമാംസാദികൾ വൃത്തിയാക്കി ശുദ്ധമായ രീതിയിൽ നിങ്ങളുടെ വീട്ടുപടിക്കലെത്തിക്കുന്നു. വിളിക്കൂ 38751237. ഉടൻ തന്നെ BQ ഫ്രഷ് ആപ്പ് ഡൗൺലോഡ് ചെയ്യൂ. ഗൂഗിൾ പ്ലേ സ്റ്റോറിലും ആപ്പ് സ്റ്റോറിലും ലഭ്യമാണ്. കൂടുതൽ വിവരങ്ങൾക്ക് സന്ദർശിക്കുക www.bqfresh.com.
For different varieties of food made in a healthy surrounding under specialized chefs, tastes from all around the world under one roof. Indian, Chinese, tandoor, grill and juices. Southern Spice Restaurant. Enjoy life. It's delicious. Now with free home delivery and takeaway services with bulk orders. Dial 1721-4555. Near Indian Club, Zubara Avenue, Manama, Kingdom of Bahrain. Southern Spice Restaurant. Enjoy life. It's delicious.